Preet Cargill.
Thank you, Madam Deputy Speaker, and I welcome this bill. I have long argued that a strong state must be rooted in work, in contribution and fairness, and that principle stands behind the medical training bill. For too long, medical training pathways have drifted away from that principle. The taxpayer invests heavily in medical education, clinical placements and postgraduate training, yet we have not been honest about who ultimately benefits from that investment. And at a time when the NHS is under immense pressure, that is not sustainable. The Secretary of State set out the scale of what we're dealing with. The taxpayer currently invests over £4 billion every year in medical education, with more than £1 billion in undergraduate clinical placements and over £3.3 billion in postgraduate foundation and speciality training. That is public money spent so that British patients have the doctors that they need. But since visa restrictions were lifted in 2020, we have seen a fundamental shift in how medical training places are allocated. In the 2025 recruitment cycle, over 25,000 overseas trained doctors applied for training posts, compared with over 15,000 UK graduates competing for the same nearly 13,000 round 1 and 2 positions. And overall, as we heard from the Secretary of State, applications for 2026 exceed 47,000 applicants, a dramatic surge. So this bill does one straightforward thing. It prioritises UK medical graduates for training posts, both foundation and speciality, where the NHS has already invested heavily. In my own constituency, we see this clearly. University Hospitals Birmingham is one of the largest NHS trusts in the country, and just under 30% of my constituents work in the health sector, which is double the national average. We are home to the University of Birmingham Medical School, one of the best in the country, and the scale of public investment in training, in supervision and infrastructure is enormous, and rightly so. And this bill recognises that basic truth, that when the taxpayer pays, the public should see the return, and prioritising those most likely to work and stay in the NHS is not exclusionary, it is common sense. It is how we rebuild a health service that is resilient, staffed and fair.
On that point,
I will.
I'm very grateful, Chair, I entirely agree with her that we need to keep Brits working in our National Health Service. So does she agree with me that we need to add to the priority list British nationals who, for one reason or another, are training in medical schools other than in the UK, in Prague, in Malta, in Cyprus and in the Caribbean? The reasons for them training there are many and varied, but they are British and their intent is to practice in the National Health Service, and yet they're being deprioritised by this measure.
I'm not the chair of the Select Committee, and I think the Secretary of State set out his position. This is really important. This is about UK taxpayers' money being invested into training doctors, and we've got to make sure that UK trainees are able to get those trainee places once they graduate, and that is inherently the issue here that we are talking about. But let me be clear, this is not a criticism of international staff. The NHS would not and could not function without the dedication, the skill and compassion of people from around the world. And we should say that plainly and with gratitude. Every day, they hold our system together. But a mature, confident country can value that contribution while also saying this, that we cannot substitute long-term workforce planning with permanent reliance on overseas recruitment. That is not fair on British trainees, not fair on source countries, and not fair on the NHS itself. We heard from the Secretary of State that the World Health Organization estimated an 11 million shortfall in health workers by 2030, as every country competes for the same limited workforce. And this government understands that putting British workers first is not something we will apologise for. It is what the public expect. The Prime Minister has been clear. A serious Labour government must align migration, skills and training policy with the national interest. We cannot simply be passive, and we must shape our domestic workforce to ensure the NHS can continue to function. The same principle should apply wherever we are overly dependent on skilled migration, because domestic training has, and we know it has been neglected under the last 14 years under the Conservatives. Investing in people here and expecting that investment to strengthen Britain is not ideological, it is responsible government. The powers conferred to the Secretary of State in this bill are important. The Royal College of Radiologists 2024 census found that 83% of cancer centre heads of service in the West Midlands were concerned about patient safety as a result of workforce shortfalls. In 2024, only 19% of clinical oncology training places were filled in the West Midlands. And can I ask the Secretary of State, will he outline how he intends to use the powers in this bill and work with the ICBs to ensure access to training matches regional workforce needs and health demands? Madam Deputy Speaker, above all, this bill is about respect. Respect for the taxpayer, respect for the NHS workforce, and respect for a health service that must be planned for the long term, not patched up year on year. And this is exactly the kind of reform the public expect from a Labour government, serious about work, serious about contribution and the future of our NHS. Thank you.